Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate, a great tool offered to all candidates going for MRCS Part B by chatGPT, which is called a study mode. This has just been launched just a couple of days ago, and it is a great tool. My summary. Artificial intelligence offer a lot of tools for candidates to study better than before. And this tool is free to use, doesn't need any prescription, and it is very interactive. And if you get an information, if you remember to put like memorization curve, when you get read information, your retain of memory is something around 30%. But when this information, the same information, has been answered to a questions, so you get a question and the answer, your retain of memory will jump to around 80%. So this is a lot better way of learning how to retain information much better. So let us go to how we can do that. All what you need to do is to go to a ChatGPT link, and you need to sign in, and you create tool like this. And when you press on tool, you will find study and learn, and you click on it, so will be active. You will get a definition. What is this new tool? And let us apply it to an exact example. So for example, you put, I am a candidate for MRCS Part B exam in next November, and I want to learn more on consent for OSCE stations in MRCS, and you put enter. Because I already trained it to reply to me as Dr. El Farouk, but you don't need to do that. And it will mention here the consent form, and it will mention some preparation tutor. First, couple of quick questions. How are you ready? Study structure of consent form. It want to know how much level you are in, and do you want to begin general principle or jump into replay practice? So you can have one of two options. You can either start knowing a bit of information and then do a replay. So he will act like a patient for, let us, consent for hernia. So this information, let us say I am a beginner and need to get general principles first. So he will put here some general principle because it is very important. What is consent station? Definition. It's a communication skills station where is a junior doctor make an informed consent to the patient. And you need to know how to explain the procedure, to discuss risk and benefit, how to answer patient concern, how to check understanding. You need to stop and ask the patient, do you understand what I'm saying? Or shall I clarify it more? This is in order to get a valid consent according to UK. There are three pillars of a valid consent, which is capacity, voluntary, informed. Capacity is the patient understand and retain and wait information and a communication of a choice. Voluntary, deciding freely without any pressure. So you don't have any pressure to do an operation. This is voluntariness. Informed, you must know what operation you will be having. And this is why it is called informed consent. And capacity, you have the judgment to say yes. And this is what is called informed consent. So, for example, children cannot give a conformed consent. Patients who are confused or with neurological deficit cannot give an informed consent. The structure of the station, the abbreviation is a chatter. Use this as a mental checklist. So, a chatter is a great useful tool for you to remember when you are doing a consent form for a patient. And chatter stands for check patient identity. Always don't miss this question. Can I know your name and and your age or date of birth, please? Then H for history recap, indicating the procedure. Do you suffer from inguinal hernia, I believe? A, alternative, include no treatment. So if we leave the hernia, you might have complication. Talk through the procedure and talk about the risk, common and serious risk, and expectation, benefit, and recovery. Repeat any concern, clarify, understand. So you see, this is a lot better than going quickly to a role play. So I always advise you to have a summary, and this is, remember, a chatter, a scheme with consent form. Timing, station, as we all know, is 9 minutes, and the task, then use a chatter framework. And these are the 3 pillars. So let us role play a consent form for inguinal hernia. Okay, so inguinal hernia, classic consent form station, role play. You will be the doctor, I will be the patient. So here, GPT will play the role of the patient. And this is the scenario. You are FY2 and you've been asked to consent to Mr. Ahmed, 45 years, elective open inguinal hernia. Now, I will show you an example that I will do deliberately mistakes and give you how ChatGPT correct your consent mistakes by training. Can we start to role play now?
Yes, let's dive in. I'll role play as the patient and you can practice your response. Hello, doctor. I understand I need surgery for my hernia. Can you explain what's going to happen? Now you can start your explanation as the doctor.
Yes. Mr. Ahmed, you have a hernia, which means that part of your bowel is outside the body, and this might have some complications. And to avoid these complications, we offer you surgery that we correct this defect. Do you understand what I'm saying, Mr. Ahmed?
You're on the right track, but let's refine your explanation to make it clearer and more professional,
Okay.
especially for an OSCE scenario. Here's an improved version. Hello, Mr. Ahmed. You've been diagnosed with an inguinal hernia, which means part of your intestine is bulging through a weak spot in the muscles of your abdomen. This can sometimes cause pain or other complications. The surgery we're recommending is called inguinal hernia repair. In this procedure, we'll push the bulging tissue back into place and strengthen the area with mesh to prevent it from happening again. At this point, you can move on to the risks, benefits, and alternatives. Would you like to continue with that?
Yes, I will continue with that. I will exaggerate the risk a little bit just to see your response. So, Mr. Ahmed, complication can be quite large. You can have from simple complication like wound infection up to severe complication like sepsis, cardiac arrest, and even mortality. What is your response, ChatGPT, about this reply?
Good effort in addressing the risks, but it's important to keep the risks proportional to the procedure and avoid unnecessarily alarming the patient. While complications like wound infection or sepsis can occur, cardiac arrest and mortality are extremely rare for an inguinal hernia repair in a healthy patient. Here's a more balanced response that ensures the patient is informed but not unduly worried. You, Mr. Ahmed, like any surgery, there are risks involved. The most common risks are things like wound infection or bleeding. In rare cases, the mesh may cause a problem or the hernia could come back. You could also have complications related to anesthesia, such as an allergic reaction. Very rarely, more serious complications can occur like blood clots or damage to nearby structures, but these are extremely uncommon. While mortality is very rare for this procedure, it is important to understand all potential risks. We'll do everything we can to minimize them. Would you like to continue with alternatives and checking the patient's understanding?
Yes. Do you understand what I'm saying, Mr. Ahmed? So if you have any question or query or things are not clear, you can ask me. Do you have any queries, Mr. Ahmed?
You're doing well by engaging with the patient and checking for understanding. However, it's important to phrase the questions in a way that gives the patient a chance to ask questions without feeling rushed or pressured. Here's a slightly refined version. Mr. Ahmed, do you understand what I've explained about the surgery and its risks? If there's anything that isn't clear or if you have any questions, please feel free to ask. It's really important that you fully understand what's involved. This approach encourages the patient to speak up if they're unsure without making them feel uncomfortable. Now, would you like to discuss alternatives or confirm consent? Or if you feel ready, you can close the station by confirming the patient's understanding and asking for their decision.
Excellent. Thank you very much. I enjoy your comment very much, and thank you very much, ChatGPT study mode. Now, as you can see, now I have finished the conversation. I have shown you how to learn about consent station from MRCS, how to know the basic information, how to know chatter system of consenting to patient, how to apply it well, and how to get a correction from ChatGPT. I've actually developed artificial intelligence that can do that, which is Vasai, but I'm the only one which have access to this. But this tool is free of charge, available to everyone. It is not dedicated for MRCS as my Vasai, who is dedicated for MRCS and the vascular surgeon, but still it is useful for you to study. So my advice to all MRCS candidates, start to study with the ChatGPT study and learn mode. If you have any problem, you can put it on the comment of this video, and I wish you all the best. I wish you good luck. My name is Dr. Muhammad Amr Farouk. I'm a consultant vascular surgeon.